Hey guys, I'm back again, same outfit, different video. This video is going to be about preparing for clinical for nursing school. And if you have never, ever had a clinical day, it can be a little nerve-wracking. So I just wanted to kind of put out there what I wish someone would have told me, I guess. So I know it's almost December, which means in January, if you are starting at a program that accepts students in January, you may possibly for the first time be attending clinical in the spring. So if I could give advice to you, this is what I would say. As far as clinical is concerned, all schools require that you create a nursing care plan. And a care plan is basically your game plan for how to care for your patient. You have to come up with a nursing diagnosis or multiple diagnoses or a nursing diagnosis, depending on what your school requires. In order to do this, you can use your textbook, your nursing care plan book, and other books to help you formulate an appropriate nursing diagnosis for your patient. Now, how do you get to a nursing diagnosis? Most of the time, the day before your clinical day, you go to the hospital, you find out who your patient is, you go through their medical chart, you go speak to your patient, you gather and I just sounded really country, and I don't know why. You gather subjective and objective data from your patient. Subjective data is what your patient says to you. Objective data is data that you find out. This oftentimes, since you're going the day before, you can't do a physical assessment if you're not in clinical. So you can't really go and do a physical assessment and say, here's my objective data that I found. You shouldn't do that the day before. You can go to their chart and you can look in their chart. You can look at their lab values. You can look at any scientific data that will help you understand what's going on with your patient. But it's not what they say. It's data that has been acquired through some kind of assessment or testing or something like that. Or procedure, I should say. You use that information to create a nursing care plan. Your nursing diagnosis needs to have interventions. You need to have a goal for your patient. And when you start nursing school, they're going to teach you how to create a care plan, but I'm basically just giving you the overview. You have a goal for your patient, you have interventions for your patient, and at the end of your clinical day, you should be able to evaluate whether your interventions were effective or not, and you can determine if they're effective if your goal has been met. If your goal has not been met, your interventions may have been good, but they didn't help your patient get to the goal that you set out for your patient. Clinical day, when you show up, make sure that you show up on time, that you have everything that you need, that you definitely have your name tag, your stethoscope, and your pen light. Of course, you need an ink pen. You may be required to have scissors on you or whatever like that, but chances are if you accidentally forget a pen, someone else is going to have a pen, but you don't want to accidentally forget your stethoscope or your name tag because you're going to be up the creek without a paddle if you do that, so make sure you get on top of that. Clinical day, show up on time, make sure that you have the materials that you need, and in the morning, go in, get report from your primary nurse, whoever's taking care of your patient. More times than not, when you show up before the new nurses, the new shift shows up. So let's say you show up at 6:30, the new shift is supposed to be there at 7. You're there at 6:30 at the nurse's station. Your nurse may not get there until 6:45 or 6:50. Then they have to get report on all of their patients. You need to go with your primary nurse and listen to the report that she gets. Or if that doesn't work, you can just get report from her once she finishes. It depends on your institution where you go to school, what they require. But at my institution, they allow us to go into the patient's room and listen to the night nurse give the AM nurse report. Once you give report, you go into the patient's room, introduce yourself again if you already saw them the day before, or introduce yourself for the first time if you show up and your patient got discharged, and you take your vital signs and you do your head-to-toe physical assessment, you rate their pain and all that other jazz, and you determine what AM care they need. Once you leave the patient's room, and you've documented, maybe they have information in the room where you can document, or you have to go outside to document what you have done, give report to your nursing instructor, and we use something called SOAP. So we give subjective data, what the patient says, objective data, assessment findings, and our plan of care for that patient. A lot of this information you will have been able to acquire based on what you researched the day before you came in for clinical. Your nursing instructor will want to know about, well, at least when you learn about IVs, they want to know what's running in the IV bag, what is the rate that it's running at, and if your IV bag needs to be changed, if the IV site needs to be changed, or if tubing needs to be changed. Those are things that you need to know about. When you look into the patient's chart, you need to see if there are doctor's orders that came in, and if there are doctor's orders that you as a student nurse can implement. Once you take care of all that and you do your AM care, a lot of times you can be implementing your interventions. Sometimes these are conversations, sometimes they are maneuvers or position changes that you do with your patient. It just depends on what your patient, what the outcome that you want for your patient is. So I would say that's, a big thing, to make sure that you know your interventions. And look at your nursing care plan, even if it's one sheet that you put in your pocket. Look at it throughout the day and make sure that in addition to completing tasks that your patient may need, your patient may have a colostomy bag, they may have a catheter, they may have other things that they need, incentive spirometer and wound dressing changes. Not to say that you're going to do them, or you might do them. It just depends on the institution that you go to and what they allow you to do. But in addition to all of the tasks that you must complete, make sure that you are implementing your interventions. That's the best advice I can give you for a med-surg clinical day. I am currently taking psychiatric nursing and women's health nursing right now, and clinical day is a lot different for mental health nursing. You do not actually have a care plan that you have to create. A lot of what you do in mental health is communicate with the patient, so a lot of it is therapeutic communication, and you will learn how to communicate in a therapeutic manner with patients that have mental illnesses. And we go to meetings with the patients. Patients have group therapy, they have behavior cognitive therapy, they may have team building or music therapy, spiritual wellness, they may have sessions on women's issues. There's just a lot of different things that the patients are offered, and we're able to go and sit in on those meetings with the patients and communicate with them. So it's just different, but I would say, be mature, be prepared, try to understand a lot of the mental disorders that you learn about: bipolar disorder, personality disorder, schizophrenia, depression, anxiety, all of those sorts of things, because the more familiar you are with it, the more comfortable you're probably going to be interacting with people that suffer from those mental illnesses. And as far as women's health is concerned, women's health is really interesting. We are given the opportunity to rotate in postpartum, labor and delivery, newborn nursery, and at a health department. So it's different for all of those entities, but once you get there, you'll pretty much know what to do. I mean, I could tell you about the BUBBLE acronym for postpartum, but it won't make much sense to you until you get to women's health. So with that being said, if you have med-surg clinical coming up in January, good luck to you. I'm sure you're going to be fine. Use more than one book to make your care plan, and really try to understand why your patient is going through what they're going through. If they have diabetes and you haven't learned about diabetes yet, try to learn a little bit about it. Generalities. There are lots of websites online that you can go to. Even if your patient has pancreatitis or GERD or cancer or hypertension, there are resources that you can find that can explain that to you. So even if you take care of a patient and you have no clue what they have, you can find a way to find out a little bit about it, and then find out what is the nurse's responsibility in providing care for this patient. Even if they have something that you've never heard of. I'm sure that there are plenty of registered nurses out there in the world who have taken care of patients and they didn't have the first clue about the disease process, but they had to learn about it. So don't be overwhelmed, don't be intimidated, be confident, prepare yourself, and just put your best foot forward, do the very, very best that you can, and try to be organized, and just know that this is something that you can do. A lot of people before you have done it. Believe in yourself and do the best that you can. If you find out that there are other people in your class that are doing really, really well in clinical, talk to them you know, try to get advice from them and try to get help from them, because just like you want to be, just like they want to be a really good nurse, they probably want you to succeed and be a good nurse, because who knows if you're going to take care of someone that they know. So we're all kind of in this together. We all want each other to be successful, because you don't know who's going to end up taking care of you in the future, or end up taking care of somebody that you may know. So if you have questions and I didn't answer them, leave your questions below, and I promise you I am going to answer your questions. And I hope you found this helpful. Have a good day. Bye.